This is a demonstration, a continuation of the demonstration of Academic Accommodations Request Packet. This is page 2, and the content of this video is about documents. Professional disability documentation requirements. Students are responsible for gathering and submitting clinical documentation. Qualification guidelines. Themes professional documentation must address. Diagnosis, 1. 2. Assessment. This means the methods, the results, and the interpretation. 3. Symptoms. Refers to characteristics, severity, duration, frequency, triggers, etc. 4 is effects and supports. This refers to recommended accommodations, strengths and weaknesses, symptoms, effects on academics, recommendations, academic limitations of student, accommodations history, etc. Another guideline refers to the validation of professional documentation. One that thing is looked at is it must be written on official letterhead. 2, it must include professional credentials. And 3, it must include a physical signature of the professional. Something to keep in mind about neurocognitive tests. They must cover the following domains: complex attention, executive function, learning and memory, language, perceptual motor, and social cognition. The final qualification for the guidelines for the documentation is age of professional documentation. Neurocognitive tests must be no more than 3 years old. All other tests, such as intelligence tests, achievement, aptitude tests, clinical tests, personality tests, behavioral tests, psychoeducational evaluations, and the like, must be no more than 5 years old. Types of clinical documentation is the next category. These are examples. So a full and independent evaluation, or FIE, Texas uses this. There may be others as well that do. Is also called an independent educational evaluation, or IEE report, of diagnosis, psychological, cognitive assessment, and evaluation results from school districts. So this is a psychoeducational evaluation, and their documents are named those different titles. Another type of clinical documentation is psychoeducational evaluation, done by an independent psychologist. Must use in-depth tests and not screens. Additionally, psychological or psychiatric evaluations and diagnosis reports. This is supported with testing results administered by a qualified professional. And finally, physician's or therapist's letter. This must also be in great detail and address the themes from page 1. Next category is types of supplementary documentation for academic institutions. So these documents are helpful, but do not contain all of the information required. First of all, individualized education plans, or IEPs, can provide a list of recommended accommodations, but will not serve as official diagnosis documentation. An FIE or IEE will be needed. See clinical documentation. Next, 504 plans. If the student received accommodations or was identified as disabled under Section 504, the high school counselor should have copies or be able to have copies sent to the student or to Academic Accommodations Office. Finally, admission review and dismissal. This is an exit ARD report. Summary of performance, school district disability document providing an overview of interventions, accommodations, and performance throughout the primary and secondary grades. This will not serve as official diagnosis documentation. An FIE or IE will be needed. Again, see clinical documentation above. Please complete and return everything after this page.